So I wanted to ask you, looking towards the future, in education in New Hampshire, we certainly have had our struggles with any kind of support, both for nurse practitioner and physician education, and trying to figure out how to maximize those dollars, but also the support system within the university. So what do you see as the challenges for nurse practitioner education to really move to the next place?
I think because nursing salaries are for the most part compressed, nurses don't make bad money, but they usually look to the future of not making really extraordinarily high salaries. So tuition burdens, the loan for tuition for graduate education is an ongoing issue. We seek and sometimes we get federal support for that, but often our students are holding the bill for that debt burden. Loan repayment for the state of New Hampshire providing loan repayment is always a really good thing. That does allow students not to have to consider what their debt is when they take a position or when they're moving to a new job. So, being in a state institution, we are committed to meeting the healthcare needs of the state. So, our program is run, on a tight budget, but there's not we will survive and we will sustain and we will grow to a certain point. But we have intentionally kept UNH's program focused on quality and assuring that students that come to our program do have high quality clinical placements and that we're able to meet the needs of the students, that they're paying us for that service and we provide it. However, on a statewide basis for all the programs, RIV and Mass College of Pharmacy, the other programs that provide good, solid nurse practitioner education, I think we all would like to be sure that our students aren't burdened by tuition, understand their obligation to pay for some of their education, but understand that as we look for a correct distribution of the workforce, that any loan repayment program does encourage people to redistribute as needed across the state, that we are sensitive to what that debt burden does to nurse practitioner salaries and to their families, and that we do work to attract students in NP education that reflects the makeup of our emerging minority population, the people that are new citizens to New Hampshire or are newly represented in the citizenship of New Hampshire, and that our students look like the people we serve, that we end up having a diverse workforce as best we can. So,
Excellent.
yeah.
Thank you so much.
Well, thank you.